Hi, Dr. DeSapri here, founding physician of Bone and Body Women's Health. Today I'm reviewing the literature on exercise and bone health for an upcoming lecture. And incidentally, there was a new article in the New York Times yesterday about bone health and exercise, and can exercise strengthen our bones? Well, the answer of course is yes. We know that exercise has so many benefits, but when we think about bone health specifically, there's very important exercises we need to be doing. Things like aerobic exercise, balance and coordination, and resistance exercise. So specifically when we think about things like resistance exercise and using our own body weight, there's a lot of meta-analyses, which is basically a review of all this different studies that have been done, kind of pushed together, and to try and make some information and some importance out of all of these different separate studies. So what we know, and this was recently published a couple of years ago, and what we know is that women who are doing higher intensity, repetitive resistance training, things like doing at least 80% of your maximal effort for at least 6 to 8 different compound movements over time, at least for 6 months, using over 4 times your body weight in terms of the ground force that's applied. So things like jumping, running, aerobic exercise, or putting more body weight than you have yourself, at least 4 times more, has been shown to improve the bone mineral density in the lumbar spine as well as in the femoral neck of the hip pretty consistently. And that's compared to women who are doing maybe more like moderate exercise, like things like heel drops, or not as much exercise, resistance exercise, using their maximal effort, or doing things like walking. So I know it's very important. We all want to start where we're at, and we want to, any movement is good movement. When we think about really making a change in our bone mineral density, we need to think about a lot of things. It's what I talk about all the time. Thinking about things like medication, if that's appropriate for you, thinking about calcium, vitamin D, exercise. And when we specifically think about exercise for bone health, we really need to be using maximal effort, using our ground forces of our body weight more than what we have, doing compound exercises, and really, again, thinking about these, doing them consistently. So I was so happy to see the New York Times shouting out osteoporosis and bone health and exercise, and making this part of what we read on a daily basis. So I hope to see you soon.